Next speakers are Donna Boyd and Tina Bogaart, here to tell us about their experience of implementing antenatal hand expression in public health setting. With over 24 years of experience in public health, Donna is a dedicated healthcare leader currently serving as a program manager for the Healthy Growth and Development program at the Chatham, Kent Public Health. In this leadership role for the past 4 years, she has overseen programs that support the health and well-being of children and families, drawn on 2 decades of frontline experience as the health promotion specialist and public health nurse. Passionate about community care, she also volunteers with hospice of Windsor and Essex County Incorporated, providing compassionate support to individuals and families during end-of-life transition. Her career reflects a deep connection to health equities, preventative care, and well-being across the lifespan. Tina is a registered nurse with the Chatham Kent Public Health Unit, specializing in the Healthy Growth and Development team. With over 12 years of experience in public health, she has dedicated her career to maternal and infant health. Prior to her current role, Tina worked 18 years in clinical experience as a labor and delivery nurse and in the neonatal intensive care unit. In addition to her professional endeavors, Tina is a wife and a mother of 2 daughters. Throughout her career, Tina has been committed to providing families centered care. She is passionate about educating and supporting families, particularly supporting their breastfeeding journey. Today, Tina will discuss how the More Milk Sooner program, along with NIDA's support, was instrumental in sharing their framework. She is proud to share with us the accomplishment of her team in bringing this initiative to her community.
Thank you, Julie, for that warm introduction for Donna and I. So like Julie had mentioned, Donna and I are joining you from the Chatham Kent Public Health Unit. In 2024, our health unit decided to pursue initiating a More Milk Sooner campaign. So I'll give you just a little bit of a background on Chatham Kent. So in Chatham Kent, there we go, sorry. In Chatham Kent, we're comprised of about 12 small rural urban communities. We have 2 hospitals in our community, one in Chatham and one in Willisburg. Our Chatham site is our birthing facility. Chatham Kent Public Health Unit in Chatham Kent, we have about 993 live births in 2024. The Chatham Kent Public Health Unit was designated a baby-friendly facility in 2010. We redesignated in 2016 and are currently preparing to redesignate again this year. This More Milk Sooner campaign was important to us because Chatham Kent currently does not have a milk donor bank. And so implementing the More Milk Sooner campaign was certainly important for our community. The Chatham Kent Health Unit has been teaching hand expression in our prenatal breastfeeding classes for many years already. We were teaching about the importance of hand expression in the hospital, and our liaison nurse who attends the hospital 6 days a week to visit our new moms and babes that have just been born. We provide them with this card that's on the left-hand side, and attached to it is a spoon that they are able to express into and use if needed to give supplementation of express breast milk. So the idea of a More Milk Sooner campaign started with the Breastfeeding Committee for Canada's 2023 National Breastfeeding Week webinars. Most of our team at the Chatham-Kent Public Health Unit, the Healthy Growth and Development team, watched the seminar with Nada Hawkins, and our staff were very excited to learn more and to start to incorporate this into our practice. More Milk Sooner campaign was developed by our internal breastfeeding committee. We made the decision to start this campaign, and it also fit well into the theme in 2024 for National Breastfeeding Week, which was closing the gap, breastfeeding support for all. So our goal in implementing the More Milk Sooner campaign was teaching this simple technique of hand expression so that we could decrease the need for formula supplementation in hospital as well as when our moms go home, increasing mother's confidence to provide milk for her baby and to provide all the infants with an equitable start to life.
So I'm going to talk you through a little bit of our process. So just like Tina was saying, our internal breastfeeding committee attended the More Milk Sooner education session, and we were really excited about the potential of bringing this to Chatham-Kent. We were seeing moms struggling in that first week to get breastfeeding established. I just want to say that we were always looking to amplify what Nada was already doing with Dr. Polius there. We weren't looking to recreate their website or any of their materials. We were looking at how do we bring this here and how do we amplify that. So that's how planning started. So we decided to take on the More Milk Sooner campaign. So we ordered some kits. We also made some of our own. We trained our public health nurses on our team. We developed a policy and procedures for our public health nurses to teach prenatal hand expression. I've shared that policy and procedure with the BFI team putting this together. So please feel free to share that. It was really important for staff to feel very comfortable and confident to be teaching prenatal hand expression and when it would be appropriate and when very rarely it would be inappropriate. We recruited a local physician. So Dr. Jackie Wolting here locally is very respected in our community, and she worked with us as our physician champion. We immediately collaborated with our local birthing hospital, not only for the support, but also to help educate their hospital nurses, as well as we partnered with our local midwives. Again, not only support, but making sure that clients across the Chatham-Kent region are getting the same information and education of their staff. So our physician champion helped us book our grand rounds in October 2024. And we booked Nada and Dr. Prolius to present the More Milk Sooner information as a hospital grand rounds. And we created physician packages. So our target was any physicians here locally that would be seeing women at that 36-week mark and beyond. So we targeted some family doctors who were still delivering babies in our region, all of our midwives, and then our obstetricians. For our campaign, we really wanted it to be targeted. So I think it was 12 of them, which obviously is like a small amount. We got really creative and fun with our package. I might have had a little extra money to provide, one of those little coffee tumblers. We were acting like some of the marketing experts on the other side of the fence. So we created a nice little coffee tumbler with like a Yeti and put the More Milk Sooner logo on one side and our Chatham Kent Public Health Unit logo on the other side. We included some colostrum collection kits in that package, a letter explaining what More Milk Sooner was all about and why we were promoting it. And we had some good response back from the physicians saying that, if this is something that we were promoting, that, they were going to look at it and promote it as well. So we included the printed posters from the More Milk Sooner uh, Saskatchewan group. Again, I wasn't trying to reproduce anything. I ordered the materials from them and just helped amplify their messages, as well as we were looking at targeting the driving anybody who wanted more information back to that original website with the QR codes. So the More Milk Sooner QR codes were in the packages, sending, anybody sitting in a waiting room to NADA's videos, and as well as having like the collection kits with any healthcare provider here locally that was seeing a woman at 36 weeks. In the package, we also included some of the research articles, the client pamphlets, and again, the postcards. So we were really looking at anybody who was working with a woman at 36 weeks. It was going to be very easy to provide that information and education to the women coming into their office. We also included the More Milk Sooner materials in our own prenatal packages, as well as our breastfeeding classes and More Milk Sooner prenatal classes as well. We had gone to some of the sessions and we thought, why not open it up? So we might be driving some clients to NADA sessions because it's good to have some virtual options for our clients. We also have our clients, they're able to come once a week to our breastfeeding clinic. We hold a breastfeeding clinic every Thursday afternoon. So if somebody wanted to work with a nurse one-on-one, they could come to our clinic and get those materials and work with them. Next slide. So our ground rounds, we worked with Chatham Kent Health Alliance. That's our birthing hospital here. We held our session with NADA and Dr. Prolius on October the 11th in 2024, and it was well received. For us to have 10 physicians and 26 nurses from the maternal child team was a real success to us. And the next slide. So we're looking to keep some momentum going. So all of our public health nurses teach prenatal clients how to do hand expression at about that, 35, 36 week mark. And through our Healthy Babies, Healthy Children program. And prenatal moms can attend that breastfeeding weekly clinic. We're proud to say that we're already seeing the collection kits come into the hospital. Our liaison nurse sees them at the bedside and people are bringing them in. And working with our partners has helped to make sure that, storage and handling pieces are taken care of at the hospital and that moms are supported when they bring in their kits, that they're stored properly there. So we will continue to collaborate with our hospital partners and midwives. Our barriers, we didn't really experience any barriers this time along. And, originally when we were asked to do this presentation, we were asked about any challenges or solutions. And what I was kind of thinking is, wouldn't it be great if there was a policy that, all obstetricians, all midwives, anyone seeing, women during the end of their pregnancy had all this training in breastfeeding. That's my, big picture, thinking on policy pieces and education changes. And the impact on staff, making sure that we have policy and training for our staff is really important. So I wanted to make sure that everybody had confidence and skills, and not only to teach it, but to feel comfortable with, feeling good about teaching their clients how to do prenatal hand expression, and collaborating with our community partners to make sure that we are working together. And like I said, we're increasing moms' confidence and skills in those early hours. And that's it from me. So I just want to say thank you to Nada and Dr. Prolius for starting this work. Thank you for continuing to contribute to it. We just recently bought some more kits. While I still have a budget and can still get these things free to our local clients, we're going to do that. I did tell my midwives that maybe in the future I'll be reaching out to them to help supply kits, because we're going to try to keep them available to everybody for free while we can, and continue to grow the momentum. So thank you so much for starting this important work, and we appreciate your leadership in that piece.
Thank you, Donna and Tina, for sharing your insights on